First, I would like to introduce the speaker to you all. Air Commodore Dr. Sanjay Sharma has the distinction of being the first consultant administration of the Armed Forces Medical Services. He is an alumnus of the Armed Forces Medical College, Pune, and a college of Defense Management, Secunderabad, where he took the Higher Defense Management course and completed his master's in management studies. He underwent training in pediatrics from prestigious Army Hospital Research and Referral, Delhi, and also holds a PG diploma in sonography. During his career, spanning more than 3 decades in the Indian Air Force, he has been responsible for providing primary and secondary medical care to the personnel and families residing in Air Force stations and has commanded 2 Air Force hospitals. He has represented the Indian Air Force's medical services in the first international conference on the doctrine of IDF held in Tel Aviv, Israel. He coordinated the medical effort during the humanitarian aid and disaster relief operations carried out by the Indian Air Force during the flood relief ops in J&K and Pune in 2014, and earthquake relief ops in Nepal 2015. His area of interest has been in the delivery of social and community healthcare. During his tenure as the commanding officer of a hospital in West Bengal, he has trained 200 local women as community health activists. He has formulated and runs an adolescents health program for the Indian Air Force known as Pragati Path, and he has been working with specially able children and has assisted their parents in forming a self-help group known as Samanvay. He was instrumental in setting up the Alcoholics Anonymous branch, Suhani Subha, and the AL Anonymous branch, Mangalmay, in the IAF. He also carries the distinction of being the consultant architect of the Station Medicare Center of the Air Force, Palam, which has been designed by him. In recognition of his services, he was awarded the commendation by the Chief of Air Staff in 2013. His journey and first-hand experience of being a parent of a transgender child struggling with identity has prompted him to seek voluntary retirement from the Indian Air Force and dedicate himself towards the pursuance of his mission of working for the welfare of the transgender community by raising awareness and providing holistic healthcare to the marginalized subset of the society. He is also the CEO and the Managing Director of the Association of Transgender Health in India, ATHI, board member of the World Professional Association for Transgender Health, WPATH, and mental health advisor, ADRA. Now I would request sir to take the mic.
Thank you so much for that very extensive introduction. And you know what? Actually, all that is to catch your attention so that you really believe that, I am speaking from a position of knowing something. And transgender healthcare is a very new field in India and even in the world. So we really know only something. And what we know is actually the tip of the iceberg. Because this experience of gender in itself is a very unique experience. It is something which what I experience is very different from what another person sitting right next to me experiences. In fact, we say that it is as unique as your thumbprint. How much of maleness that I feel inside or how much of femaleness that I carry is entirely mine. This is what I am. This is what defines me. When we look at gender from this perspective, it becomes very difficult to fit it into a binary of saying that, okay, am I male or am I female? For a large percentage of people, the choice is that can I stand in that line of male and be comfortable? Or can I stand in that line of female and be comfortable? Now, most of us, when we come into the world, and are a part of a family, and around about the age of about 1.5 to 2, when we are seeing all these human forms around us, and that is the time when we start wondering as to who do we fit in with. Is it this female looking figure, these soft contours, and this kind voice that I identify with? Or is it that authoritarian person who is, stepping forwards to look after most of my needs? And is it a blend of these two uh, poles, so to say, which is given by most of the caregivers who are around me? To help me in this journey, I look at the cues that people surrounding me give me, and these are known as gender cues. So that pink blanket, that uh, female looking doll, or that gender role that is put in front of me, wherein I would probably be playing with guns or having a tumble play, which would help me, you know, mm, uh, align to what form that I want to be. And mind you, all this is happening very early. This is happening as early as 1.5 years to 2 years, and maybe even earlier, because there are studies which have been done in neonatal ICUs, wherein babies have been found to have preferential turning towards the female form. So, individuals recognize different human forms very early, and they start looking for identities. That means I start looking for who do I identify with very early in life. If this identity matches with what is shown to me by others, then I am in a comfortable position, and this would say that I am congruent with what is put in front of me. And probably I would be comfortable in standing in that line which says male or female. How do the caregivers around me give me cues? Well, the meter that they have is to look between my legs and see what is down there. The assigned sex, the external genitalia, which tell the person that okay, now we have a male-looking genitalia, and hence we need to give cues which would help this individual stand in that line. A very incorrect way of approaching stuff, because if you are talking about identity, then it cannot be based on what is external. Earlier, we used to say that this is biology. This is how human forms are. They are just two human forms, male, female. And how do we say that? Because externally, we have a male looking thing and we have a female looking thing. And if there is something that we see which we cannot decide whether this is male or female, we put it under a third category, which where we say that this is ambiguous. When we say ambiguous, what it actually means is that the doctor or the birth attendant cannot make out which uh, sex to assign to this human form. And this is the component which is commonly known as intersex. Is this the same as people with gender incongruence. No, it is not. This is differences in sexual development, and they are very different from the variance in the gender experience. I hope I have not confused you, but the very reason that we are having this talk today is because of that blessed uh, section of people who can see beyond the binary, who can have the courage or to have the ability to express beyond the binary, and who today, I hope, are looking for how they can achieve, or how science can provide what they desire inside, or what is the ability of the medical profession to align with their affirmed gender. Yes, this is a very interesting field, and I that takes me back to the first statement I made, that I know something about transgender healthcare, just as most of the medical fraternity in India does. Yes, I know a little more because I went through an experience wherein my child educated me after having spent 3 decades in the medical field, that look, the world is not binary. A revelation, just as that person who stood up and said, look, the earth is not flat, it's round. And just as those people who were listening to this statement for the first time, so was I, very confused, very angry. Uh, I felt that the evidence that was given to me so long, how could I just go against that and believe this person who's now telling me that there is much more than the binary world that I have seen, or I have been shown? Yes, our entire education system, our entire society has been constructed in a binary fashion. And that is what blinds us to this beautiful spectrum, which is of variance, which is aligned with what nature designs. Have you ever seen two flowers that look alike? Have you ever seen, uh, if you step out into the nature and you say that, they are all similar, or there would be just two forms? No, it doesn't happen like that. God didn't design the world like that. Nature designed variety, and nature designed us all. And yes, we do exist. And when I say we, I mean the human beings. The human beings are very different from the two human forms which we commonly see. And the human being is more about how I am wired in my brain, how I perceive things to be as I develop from a helpless little infant to a strapping youth who is capable or desirous of doing more for their own, of going further and having companionship, of going further and parenting. Yes, all these are very human emotions and needs, which all forms of human beings should be able to enjoy. And if today we talk about progress, then this is progress where what we have learned due to the higher functions that we have, due to the evolutionary strength that the human beings have over all other forms that exist on the earth, of being able to provide comfort to each and every form, then this is real progress. And this is the progress that I'm going to talk about today. Uh, the topic that is given to us is an overview of gender affirming surgical interventions. Uh, a little word about why we chose to say uh, gender affirming, because we agree with what narrative the individual is bringing to us. We are not countering that narrative, and hence it is gender that the person is coming with to me to seek my help to realize what they experience. I affirm. So hence it is gender affirmation. Surgical is anything that needs a knife and needs some procedures. So yes, that is the surgical part of it. And why do we call it intervention? And why not call it treatment? Well, the moment I say treatment, I also imply that I am probably trying to correct something. I am probably trying to cure something. How can I correct or cure what is natural? So, hence, we have carefully chosen the word intervention, because intervention can be done by science. An intervention of the ability of science to give wheels has increased the ability of the human beings to travel. The intervention of giving human beings wings to fly have made the globe smaller. The intervention which permits me to talk to you people, you beautiful people all across India, today with the help of technology, is increasing our ability to express ourselves and enjoy what has been caused to us. So, hence, this interesting way of looking at uh, care rather than cure, looking at individuals rather than patients. And yes, this is the change that the medical fraternity is facing, the change in attitude that I need to make when I look at an individual who approaches me for interventions, which I have learned in medical colleges from my skill training, which involves the field of medicine and surgery, involves the field of endocrinology, mental health, preventive medicine, and cutting edge technology. That yes, I here exist to give care instead of cure. Surgical care is a very small part of what a person with gender incongruence desires. Before I go on to what a person with gender incongruence desires, I need to talk a little bit about gender incongruence as such. Gender incongruence is a term which is very new. In fact, it was born on 18th June 2018 when WHO announced, while it was talking about introducing the uh, 11th International Classification of Diseases. It is at that time that they introduced this word gender incongruence. But then any word which comes into the medical field or in the scientific world does not come lightly. There's been a lot of debate behind this word. And the debate that got this word gender incongruence came from the realization that presence of diversity in human form was recognized, and we had scientific evidence to support this. So hence we said that if what is assigned by the caregivers does not match what is affirmed by the individual, then we would term this to be gender incongruence. That means if you have assigned me male, female, or ambiguous, however, I in my mind perceive and affirm to be male, female, or non confirming, then I would fall into this beautiful category of gender incongruence. And I would also be uh, about 2 to 4% of the entire population of the world, or 2 to 4% of the types of human beings that are there. Now, this 2 to 4% is a figure which is coming from uh, clinics and hospitals where people are given treatment based on insurance. And these treatments are available in the West. What exactly is this figure for a country like India? We really don't know. But when we had these progressive thoughts of introduction of this term gender incongruence, and we had this progressive knocking down of a law, Indian penal law, which criminalized homosexuality, we suddenly had people who stepped up. And now we see, and again, we have evidence coming in which says that the percentage of people who do not conform, be it due to gender or due to their sexual orientation, may be as large as 15 to 16% of people. And that is huge. Do we need to change? Yes, we do need to change. We need to open our eyes. We need to start providing for this wide subset of normal people who are now stepping out. Why were they not stepping out earlier? Why did I not see any person with gender incongruence while I was doing 3 decades of medicine? Well, because you never provided an environment which was conducive to a gender incongruent person coming out and speaking to you. As simple as that. You were never tolerant of any diversity. As simple as that. You did not provide for people with diversity. As simple as that. And come along. How can you ask me this question when you started providing for women only about 200 to 300 years back? And when you were blind to that big a segment, it should not surprise you that you are blinded to about 14 to 15% who do exist. So we are on a journey of learning. I am going to learn from you. And today I am going to put forward what we know as of 2021. There's one organization called WPATH, that is the World Professional Association for Transgender Health. And this is the organization which initially started as a group of doctors who became aware of diversity and started providing their skills to help these diverse people, mainstream or achieve what they desired. Earlier results were very disastrous. In fact, uh, the success rate of their surgical interventions was very poor. And I'm talking about 1960s. And it started as the Harry Benjamin Clinic. But then slowly, as evidence started gathering, as the way of delivery of healthcare started changing, when insurance came in and people started approaching the healthcare providers, as the surgical skills started improving, as the medicine started evolving from being a mysterious mumbo jumbo to a scientific stream. Uh, this Benjamin Clinic changed into the World Professional Association for Transgender Health, and they started writing protocols. They also started gathering medical evidence. All this while surgeries were being done, hormonal interventions were being done, issues were because what was found that people with gender incongruence had very high incidence of self-harm, incidence of very high incidence of violence, and very low life expectancy. In fact, as late as 2010, people were saying that the life expectancy of a person with gender incongruence barely hits the fifth decade. I'm already past my fifth decade. And to say that people with diversity would not be able to enjoy what I'm enjoying is really horrifying. So, the World Professional Association has put through standards of care. And the last standard of care that it put across was in 2011, which is called SOC 7. My journey in India started in 2017. And by 2018, we had set up Association for Transgender Health in India. We started aligning with the World Professional Association for Transgender Health. And we got all the professionals who are working in India on this on one platform, and we put them in front of the community of people with diversity, so that they could start understanding what their needs are and start looking at gender in the context of India. Why is it important to talk about India? Because gender and the experience of gender depends upon what place you are from. What it means to be a female in the West is very different from what it means to be a female in here in the Indian subcontinent. How we approach other human forms is very different from how human forms in the West approach our family values are very different. Traditionally, the Indian context has been a place where the family structure has been very strong. We have also been more progressive than the West, also been more tolerant for diversity. And the proof is of the diversity that we have put on our temple walls, of diversity that is available in the archaeological digs that have happened in our country. This was much before the invaders came across, and they used science for violence. Metallurgy was used for making weapons. we were using metallurgy to make pots. We were making agricultural implements. We were having civilizations where we were living together. So all that has wiped out, replaced by a binary world. And today we want to reconnect back to our diversity and reconnect back to the system that we had, where we were able to provide for diverse people. I know this is a slightly longish introduction to something which was purely surgical, but then surgery is but 1 month to 2 month period in a person whose gender incongruent's life. This is something which the person will use or take recourse to only when they are looking for affirmative care which helps them in certain functions of procreation, functions of sexual pleasure, functions of companionship, functions of fitting in. And I'm sure we have a very diverse audience who's listening to this. For a 18-year-old or a 15-year-old, the approach for surgical care is very different from that of a 30-year-old or a 40-year-old. And care is available for everybody, and care is needed for everybody. So I'm going to take a small pause here and also give you, if you have any questions which you have for this initial bit that I talked about, we can take those, or I can go forwards to surgical care. If there is a moderator around, should I carry on, or would you like to pause here and give a break?
Sir, so you can carry on, and we will take the questions in the end so that there is no break on what you're saying and all the questions can come out in the end.
Okay, so great. So now that we have put the intro behind us, right, let us come to the meat. Transgender health care, it ideally should start as soon as any individual comes into the world. Though we say transgender, actually we talk about an umbrella. And this umbrella has gender incongruence as a large part of the larger part of this umbrella is made up of people who are gender incongruent. But this umbrella also includes people who would have differences in sexual development and differences in sexual orientation. So there are three things that I have said in the past two sentences. I have talked about gender, I have talked about development, and I have talked about orientation. So gender is the pedestal on which this feeling of who am I stands. And once this is defined, or this milestone is achieved, then I go on to the next issue of who do I want to be with. And that part is more related to attractions. And attractions may be for on a romantic front or for a sexual gratification. So sexual orientation would come from a space where my gender affirmation has more or less done. There is a group where I have differences in development. So if you look at yourself and you were to cover half of your face, it's fine. But the right side, so there is a subtle difference in each and every one of us. In fact, in our own bodies also. Some differences in sexual development, and now we are talking about the external and internal organs, would be markedly great and would be visible to the medical people. And this is the group which comes under differences in sexual orientation. Early recognition of gender incongruence, that means what I think inside, or attractions, what I feel, or how my body is made, which is differences in sexual development, would help in giving this care. So we are talking about care starting at the pediatric element, starting from maybe -9 and carrying on into early childhood, school age, college, and further. We all know that human beings require a little more care before they are able to go and do what they wish to do on their own. And this is, the early childhood, you do require care of parents. Get into a structure, there are some decisions for which the maturity of the brain is required. And there is the third part of develop the make financial decisions and make social decisions of marriage. Once you reach the age of adulthood or maturity, which is about 18 in the Indian subcontinent. And why this 18 figure is coming in? Because by then, your body has grown completely. Your bones have increased to the desired height that you want to achieve. Your muscles have developed accordingly. Your organs have developed accordingly. And this is aided by the natural process of development. You attain a certain level of growth, which then allows you to perform as an adult. So, a person's journey starts from early puberty to puberty, or a pre-puberty, puberty, and adulthood. We do not intervene with surgical stuff before maturity. And the reason is very simple. It has got nothing to do with abilities, but it has got everything to do with results. Because most goals which people come to us for are related to uh, function, which is part of what you would want to do as an adult. So surgical interventions happen after a person attains maturity as far as the body growth is there. This growth is aided by what are known as hormones, which the body produces. And these hormones affect not only our mind, but also produce changes in our body, which are known as secondary sexual characters. Now they are called sexual characters, but this is a term which is carried over from the times when we were very sort of cut and dry in our approach to life, saying that these features would help in sexual attraction or sexual function, hence secondary sexual characters, and would also help us in deciding which form we are in. Uh, Today, we when we understand diversity, we also probably would come up with another term to define this. But for now, we will say secondary sexual characters, and this is what come in from our pubertal time. And puberty kicks in somewhere around 9 to 10 years of age, when we all children start developing into different forms. Pre-pubertal time, if we get to know about gender incongruence, and how do we get to know about gender incongruence? Is by observations which are done by the primary caregivers and the vocalization done by the child. By the pretend play that the child exhibits, by the cues that are given by the developing children. If we are able to catch these, if we are able to understand these, then we will pick up gender incongruence in the pre-pubertal stage. We also pick up gender incongruence by outcomes of behavior. That means you are not believing my narrative. So I need to do something which will draw attention towards me. So high risk behavior would probably be an outcome. You are not believing my narrative, and hence this is leading to a lot of internal conflict in me. And an outcome of that internal conflict may be self-harm, maybe substance abuse, maybe aggression, maybe withdrawal. And if I am able to pick up these, then again I will probably be able to pick up gender incongruence. None of this is cut and dried, but these are all indicators. And how do you know that a child is unhappy? Well, you know a child is unhappy when the child is not smiling, when the child is not interacting with you, when the child is not sharing with you. So this is a lot of common sense. And as all of the society as at large starts understanding the presence of gender variance, we will start picking up these things very early. A few of us do pick this up early, and when we have a child who comes into our care early, then we get a gender affirmation team to work with this child. And in this gender affirmation team, we have the primary caregiver, who may be the family doctor or the pediatrician. We have a mental health worker who works. We have people who know about the effects of hormones and also know normal development. We also get the parents and the immediate society to work along with us. So it is this team which will take care onwards. Surgical care is not given because the body is still developing. The mind is also still developing. It would be wrong to interfere over here. But if we affirm with what the child is saying, the child will remain comfortable, and we will able to take them through the puberty process in a smooth way. There are certain secondary sexual characters which are distressing. I have identified myself to be gender incongruent. I have expressed this to my caregivers. Lucky for me, my caregivers are also understanding and are ready to give me a nurturing environment. But I get very distressed by certain things that are happening in my body, which remind me daily that look, this is not what you are. And if this distress interferes in more than one sphere of my life, that means it interferes in my play, it interferes in my school environment, it interferes in my immediate neighborhood, then I would say that this is dysphoria. Dysphoria means a feeling of discomfort, a slightly large amount of discomfort, which requires little help from professionals from the mental health background. So, if my dysphoria is increasing, then I would require care, which would be gender affirming medical care and gender affirming non medical care too. However, gender affirming surgical care will be offered later. Puberty is divided into four parts. The first two parts one can sail through if the parents or the caregivers help with dress, with help with mannerism, help with voice modulation, help with hairstyling, help with mannerisms. Then we can tide over this period, and the individual can pass, and hence dysphoria can be mitigated. The need for interventions can be reduced. Anything which is happening naturally would always be better. We only interfere when we have a better design. That means if I have a skill that can make things better, then I would interfere. But if my intervention is going to produce results which are not going to match the goals that this individual has now, then I will not do that. That is an ethical dilemma that a medical provider has. So, hence, when we say that allow the child to grow, we are not saying that deny his narrative. What we are saying is get into a team, make the child understand what the child wants, and deliver as per their desires. Once the child is able to make analytical decisions, and this is starts from as early as 12 to 13 and goes right to 18, then we may review our decisions with the person who is incongruent being in the lead. And at that time, we may offer certain interventions which are not uh, completely in the surgical side, but do fall in the fringe of surgical care, where we may help with hairlines. We may help with voice modulation. Later, when the body has grown completely, and we assist with hormonal interventions, which may start prepubertal if the dysphoria is more, and we can introduce these prepubertal hormones, which are known as GnRH agonists. That means growth hormone agonists, which can be started in the prepubertal age only if dysphoria is there. Otherwise, we do not interfere in this early period, and we can also go forwards. And if we find that a person has attained full maturity by looking at the skeletal age, by looking at both the parents and also the part of the country that individual is, and we are assured that this person has achieved skeletal maturity uh, and would not interfere in what interventions we do, then we may consider surgical care. But it is never done before the age of 18, because that is the earliest that we can say that complete surgical maturity or complete maturity of the body has achieved.
Excuse me, sir.
Yeah.
Sir? Yeah, Rudra here. Sir, you have very well said just now what you said. But I will like if you go for the surgical interventions from the questions point of view, because I think you are putting across that point very clearly, which you kept, which is very important, that when the intervention should be taken into.
Yes.
I'm sorry to interrupt, but there are many questions, and I don't want that someone is disappointed with their answers. Is that okay with you, sir?
Absolutely, absolutely.
Thank you, sir.
And thank you for making me pause here, because now I will go on to the surgical care. And having defined that surgical care starts at 18, we will now address what all is feasible and possible. So, the first thing that we need when we get into any surgical care or surgical intervention is the individual capable of making these decisions or not. So, for this, when we approach a surgeon is a person who's trained in the surgical craft. When this individual comes to the surgeon, then the surgeon requires at least two mental health recommendations by the mental health professionals, which would state that this person is able to make informed decisions. That's the first thing. Second thing, we also want to know whether this person has been assisted by hormonal interventions, which are done to help in the medical transition. So, the hormonal interventions, a minimum period of at least 1 to 1.5 years, is what is desirable before any surgical intervention starts. Now, this is done because when we do hormonal interventions, and hormonal interventions, like I said, would start either pre puberty, where we are just pausing puberty, or we would start them at 16 to 18, depending upon the age of maturity, largely at 18. Then we want that the cross hormones that we give, that means if there is a male who wants to transition towards feminization, then we will be exposing them to feminine hormones, and their bodies would change accordingly, assisted by these hormones for at least a period of 1 to 1.5 years. So surgical care would then begin at 19 to 20 years of age, having at least this much of hormone therapy or hormonal interventions behind the individual. The reason is because once you do a surgical intervention, then that is permanent. If the body is going to continue changing after you have done an intervention which is permanent in nature, then it may not appear natural. Your results may not match your goals. There are certain surgical procedures which are, in fact, when we say less reversible and more reversible, because there's nothing that is not reversible. But then there are procedures which are difficult to reverse. So, if there's a difficult to reverse procedure, then we require at least two mental health recommendations to be done by independent people who would, make sure that the individual understands what is happening. I will now break this into two parts. We are talking about feminization and we are talking about masculinization. When we look at an individual, then when we see that individual, when that individual walks into a room, we can say whether this person is masculine or feminine. And that is the goal that we are looking at when we are looking at an individual's desires to achieve that. And herein comes the role of masculinizing or feminizing facial surgeries. So when we look at the face, and face is what is most apparent, then now, taking my face that you can see in front, this is a male specimen or a masculine specimen. And herein you see a hairline, which is very different from a feminine hairline. A feminine hairline would be lower and would be semicircular. Mine is in a male pattern hairline. So the first feminizing intervention that could be done is to do a hair transplantation or do a hairline fixation, which is the first surgical intervention that is done. For this, we really do not require any letter of recommendation. This falls more or less into a procedure which was considered to be cosmetic till a few years back. We now know that this procedure in people with gender incongruence is not cosmetic, because this is what helps them pass. And this is what is for them essential for life. So that is what we are telling the insurance agencies also. So the first one is the hairline procedure. I have also been told to talk a little bit about costs and tell you how these procedures are done. So what we do is we take hair from the back of from the nape of the neck and the back of the head, and we transplant this in the front part of the face to make this hairline. And this is called a feminization process. The masculinization process is actually not done. We never have requests from females who want to do masculinization to alter their hairline to look like this, because the effects of testosterone probably does that at a later age, and hence that is not what is done. Talking about here, the second part that the males who are looking for feminization surgical intervention is laser treatments to remove hair from the face and the body. And this is now being done with the help of lasers. And these are very tedious and costly procedures. They require multiple settings. Unfortunately, for feminization cross hormone therapy, it does not do much for facial hair, and the person would need laser therapy to be done on a prolonged period for getting the effect of a feminine distribution of hair, facial hair, that is. The second feminizing part, or the difference between a male and a female face, is this bossing that we have in males. And this is the forehead of the male, which has prominences, which are known as frontal bossings. In females, these prominences are less apparent, and this process of removing these frontal bossing also comes in facial feminization surgeries. The third part is the eyebrows. The males have very prominent brows, and these can also be reduced. Cheekbones can be altered to make a feminine face, because the feminine face is more triangular. And the way that you can do that is to either highlight the cheekbones or reduce the chin and reduce the angle of the jaw. So these are the one, two, three components of additional components of facial feminization surgeries that are being done. Masculinizing uh, facial surgeries are not very common uh, because for masculinization, the appearance of facial hair does look after most of the masculine appearance of the face. And like I told you, for feminization or masculinization, facial surgeries, we really do not require too much of mental health intervention. This is something which can be done even without getting a letter of recommendation, though it is always desirable to have a mental health person on board as a part of team uh, of the surgical team, because mental health does figure when you undergo any surgical procedure, because you are, once you're undergoing you're under the knife and the results are not very apparent right immediately. One needs a little reassurance by the family, by mental health people, to help you navigate this. How much time does it take for for facial feminization or masculinization procedures? Well, it depends upon what procedure you're doing. One very important procedure which I skipped out was the nose. So the nose in males is slightly downward and bigger. In females, it is slightly upwards and thinner. So nose feminization is also a part of the facial feminization. Another part is the upper lip. In the males, this part is less prominent, and this part can also be made more feminine with the feminizing surgeries that can be done. So coming back to how long does it take? Well, the procedure as such is depends upon how many procedures are done in one go, or whether we are doing each one separately. The nose jobs are done by and it could be done by ENT surgeons or by reconstructive surgeons. The maxillofacial part sits between the head and neck surgeons and the now this is a specialty which even the dentists are coming into, and also in the domain of the reconstructive surgeon. These are surgical procedures which may take anything from the surgery part is may take about 3 to 4 hours to do, but it would put you under for about 15 odd days, and a period of at least 3 months. Yes, 3 months for these scars and other things to settle down. So that is the period that you're looking at. Costs may range from as low as 70 to 80,000, depending upon what part you are doing, to as much as about 7 to 8 lakhs, depending upon what center you do and what is the extent of surgeries that you do. The risks are that we are entering the, or we are changing the bone structure, and there is a very high risk of infections coming in. There is also risk of scarring, which may go slightly more than what is expected, because as you very well know, scars on the upper part of the face would be something which is not acceptable to anybody. And if we have infection and we get onto those complications, then that would be something your surgeon would caution you against, and you also need to take a conscious decision weighing as per what skill and what procedure is being done. Coming slightly lower when we talk about the top, and the top surgeries are asked for more by uh, people who want to have masculinizing interventions, because the presence of breasts may be very dysphoric for an individual who affirms their gender to be masculine. And this is a common, which is the very common surgical intervention, which is sought by uh, females who are looking to affirm towards a masculine gender. Gender affirming top surgery uh, would is slightly different from surgery that is done for cancers and such things, because their removal of breast tissue does happen for reasons of disease. But when we are looking at making a person's chest appear more masculine, then we are looking at two parts. One is that the shape of the male chest is slightly broader and has a little taper. The nipples of the male are slightly upwards. The areola and the nipple size is also smaller. Conversely, in the female, we have a narrower chest, we have more fat tissue, we have larger areola, we have nipples which are slightly outwards. Now, when we are looking for top surgery for masculinization process, then we are going to be removing this excess tissue. We want to do this with two goals. One is to leave minimal scarring. The person should be able to remove their chest and move around just as males do. So it should be a process which would leave minimal scars, and the scars could be hidden in the hair growth that could be stimulated with testosterone administration. So this is something that the surgeon and the individual sit together and look at. If we have a chest which is very narrow, then we would be also looking at increasing the top part of the chest by using fillers and removing the breast tissue as such. Now, we have two challenges that we do. We need to reduce the size of the areola, and we need the nipple position to be the same as the male nipple position. So this process can be done by using a scar which goes either under the breast tissue, which is known as an inframammary incision, or it can be done through a keyhole when we approach the tissue through making a circular incision around the areola. It also depends upon what is the natural size of the breasts that the individual possess when they come to us. So to put it in order, the top surgery for masculinization, the surgeon would discuss with the individual depending upon the structure of their chest and the breast tissue that is available as to what procedure would suit them, and decide on the surgical approach accordingly. There is another approach which is talked about, which is in the removing the excess tissue through the fold that we have here, the part that I'm holding. This is known as the axillary fold, and we can make an incision below that and probably remove the fat tissue from there. So depending upon what suits you best, the surgeon will, in consultation with you, decide on the procedure. How long does it take? Well, the surgery itself takes about anything from 2 hours to 3 hours. It is considered to be a less complicated surgery. Uh, However, depending upon what type of incision you have chosen and what kind of care that is given post surgery, we are looking at a period of about 2 to 3 weeks for complete healing to take place, and another period of about 2 to 3 months for the entire tissue to settle in. So a complete period of about 3 months that we are looking at post top surgery, when a person can resume their normal activities. And the normal activities means that I can move my arms freely, I can lift weights, I can remove the shirt and move around if it is a masculine person. Top
Sorry,
surgery.
I'm very sorry to interrupt, sir, but we are really falling short of time. And I will like that if you can, we can go ahead with the questions further. Is that okay with you, sir? I'm really very sorry.
No issue. Or if you want me to finish the masculine part and then we can take the question, that we can do. And then the feminine part can be done at a later stage, if that is okay.
I think okay.
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 So I will
Question will be answered.
quickly go through the masculine part, because why I went into more detail with the facial and the top surgery with masculine people was because this is what is normally asked for. The bottom surgery in for the masculinizing interventions are more complex. They are more costly, and also may not be desired by all trans masculine people, because that is what we are seeing when we look at people who are walking into the clinics asking for procedures. The bottom surgery for the males involves removal of the internal organs, which is a hysterectomy and the ovaries being removed. It also would involve shipping of a penis, or by using the skin from either the forearm or the upper part of the leg, or from the side of the chest wall, and creating a artificial phallus. It would also involve using the labia majora skin to fashion the scrotum. Uh, for the bottom surgery in for people desiring masculinization interventions, this is either done in stages or it may be done in one setting. This requires a multidisciplinary team where we have the reconstructive surgeon working along with the urologist and also a gynecologist who would take on the various aspects of surgery. Uh, Costs of surgery go anything from 3 to maybe upwards of 5 to 7, depending upon which center you are going to, and what is the skill level and what is the kind of care that you are being given. Also, it would depend upon what kind of implants are used, because the artificial phallus that is created would require implants for producing erection. There is another smaller procedure which is known as meteodomy, wherein we fashion a smaller penis using the clitoral tissue. So that is also a smaller procedure which is done in case of masculinizing surgeries. I think having given you a overview, I will take a pause here and we will take on questions.
Thank you, sir. That was really enlightening. And I'll like to put forward few questions. Most of them you have almost covered in your part. Just few. Like, is there any psychological effect of surgery, this that has to be handled later on? And also the satisfaction part. I mean, how we handle that.
Okay. So, see, I would put it in a broader term as being the mental health support. And mental health support can be done by professionals or by friends and family also. Okay. Now, we are looking at a person who has something that they have imagined in their mind as to what they want their bodies to be. We have a surgeon who is trying to explain what they can do, right? We are dealing with complications, which may be simple things like a small infection in a stitch, to maybe larger things where we have issues of urinary incontinence, or because we are going to be going inside the body, and all those complications which happen with anybody in a normal setting would all be there. There are also risks of anesthesia. So matching the goal of the individual with what is put across to him and what finally they see is a issue. I will not scare anybody, but if you approach it with this issue, that whatever comes out is something that you are going to work for. You have an ability which has been given to you based on the skill of the treating surgeon, and now it is up to you how you're going to use that forwards. So if I go with this positive mindset, then I do not get very worried about how my scars look. I start aligning my mind with my body, and I can look at other things which can help me move on. At times, and this is something which happens even to the best of us who undergo anesthesia, because you're putting a person under and then you're getting him back. You may have psychosis. You may, unmask certain mental issues which were lying hidden inside, and this procedure may just put them out. Some people go into very severe depression by not seeing what they want, and herein would depend as to what level of help that a mental health professional would give you. Most of the issues get settled if you have a positive attitude, if you have helping, nurturing family members. So most of our effort is to get the family members to understand. And when we say family, I'm not talking about biological families. I'm talking about people who are around that individual, who may families, who would nurture them. We also want the social support to come in. So there is a phase where the person will not be able to work because you have wounds which require healing. And I have been constantly talking about a period of 3 months, because that is the amount that a body takes. You may not be able to do certain that would require a lot of mental health support. So that is what we try to provide to all people. And we say that please get a team in place. Don't think that this is something I will go to a surgeon, get a procedure done, and then it's out, and I'm back into being this thing. It doesn't work like that. It works best when you have thought this out. See, even a person, a so-called person who is congruent, they also need to go through puberty to achieve what they finally are comfortable with. And puberty doesn't happen overnight. It is a process which takes something from 3 to 5 years. We are now doing a surgical puberty, so to say, by doing incisions and converting. So this period that a person takes to readjust to things would also minimum take a few years. You should be prepared for that, and you should, I would tell other people who are around that please support this individual, because this individual requires little more support. They require a little more help. Today I was getting ready for this interview, and I had to ask my wife, does this shirt look good? And she said, yeah, you're looking good. And that gave me so much confidence. So this is the kind of confidence that people around us need to give us when we undertake any care, any surgical intervention. Surgical intervention is a difficult area. It is a very difficult thing to cover in maybe 1 hour, because there will be so many questions that come in. So if there's any more, I will take those.
Sir, two more questions. One is any recommended age, or is that at any age that can the surgical interventions can be done? Another thing is how long is the hormonal therapy before the surgical intervention?
Okay, thank you. Those are very, very good questions. So any age after 18, whenever you can go in for a surgical intervention, 40, 50, 60, whenever. We also have one documented who's, even beyond. So there is no stopping you once your body is formed, right? Don't attempt this before 18. Two reasons. One, as a field, transgender surgery is a young field. Okay, we are still defining protocols. We are working towards attaining things. Also, if you wait a little more, then probably we will be getting even more cutting edge technology and giving you better procedures. Okay, so it is better to wait. Second thing is how long hormones. So when we do cross hormones, then we are mimicking puberty. And like I said, puberty is it fashions your body to achieve the shape that you desire. So when I expose a person to testosterone, then the testosterone starts masculinizing process. So it would make you slightly more bulky and slightly more muscular, right? It would put hair where they are required. So when I go on to interventions, my interventions results will be better. Okay, so minimum amount for hormones would be at least 1 year. Minimum 1 year. It is better if you do it for 1.5 years. See, and that is where the role of caregivers comes in. Because the moment you start making this person, you start affirming with what they are saying, they will become more and more comfortable. They will also be able to make the right decisions. When we are talking about breast tissue coming up, then when we expose masculine people to female hormones, then the breast tissue starts developing in a natural way. And you end up with better cosmetic results, and you also end up with a structure which matches your structure. Okay, so for any male who's looking to do feminization, minimum period of 1.5 years of hormone therapy will be desirable. Do not fall into this trap of people selling you procedures where they will tell you 3 months mein ho jayega. What will happen is that you will end up with smaller breast tissue, which is your own natural own, and a larger implant. A larger implant will cause larger issues, which the surgeon who's selling you a procedure is not talking about. It's all in that small print. So become intelligent, weigh things, make sure that you have taken sufficient hormones. Another word about hormones. I know this question has not come from you, but I would like to tell you that hormones are individual. I cannot take a hormone which my friend is taking. I cannot take a molecule which has worked for XYZ. I should take a hormone which works on my body and the changes which are monitored by my team. So this is something which is very common in the diverse young population, where people, share the prescriptions and also advise people to fast track the issues. You have a person who's been prescribed, let's say, 2 milligram, and there is some Didi who's talking about 6 milligram, and this person is jumped up. We have had people coming to us with overdoses. We have people coming to us with electrolyte disbalances, with liver damage. So we do not want to damage anything. We want things to go smoothly. When we do a net search, we find that hormone therapy, you do a Google and you say complications, you'll find a long list of complications. But if you are doing it with a team, then you'll be surprised to know that very few side effects come up. There are a few modifications that you need to do. You cannot smoke and talk about surgical results. Okay, that is just not possible. Anybody who tells you this in any other way, howsoever amount of sugar he quotes onto this statement, but if you are smoking, dear friend, your surgical results are not going to be good. Right? If not today, tomorrow they will harm you. Your endocrine results are not going to be good. If not today, tomorrow they're going to harm you. So these are things that you do not do. Once the surgery is done, aftercare is very important. I have not talked about aftercare at all because of paucity of time. I would request Raha to have a part 2 of this conversation where we can talk about these issues, because it's very important to remove these myths. And young children have so many myths that are there. When we are, if we have to give care, then the first thing that we need to do is to remove this misinformation. And I'm there for you. If you so desire another session, we will take it on and we'll break it up into smaller parts so that we can do justice to everybody.
That is so nice of you, sir. And thanks a lot for the support which you are extending to us. And we'll definitely plan another session, because I think that there is a lot more to know. And you have a lot of knowledge, and we have a year to achieve that, get that from you. Really running short of time, but before we go, there are many people who are asking about where should they approach. So I think I like one of my colleague to speak about ATHI, about Ra, and even about VFI, and then we'll go ahead for vote of thanks. I'll invite Gargi Kulkarni. Ms. Gargi Kulkarni, can you take over?
Yes, sure. Gladly. Thank you so much, Sanjay sir, for the enlightening and informative overview on gender-affirming surgical interventions. The interaction, I believe, truly clarified most of the questions posed by our audience, as well as your main session that covered so many doubts and so many questions that even I had about these surgical interventions. Thank you so much. I, Gargi Kulkarni, volunteer and member of Team Raha of Manipan Nanavati Women's College, would like to take this opportunity to briefly speak on the participating organizations for today's seminar, which proudly provide the necessary help and resources to the transgender community. Volunteer for India, our hosts and lead organizer for the day, is a pan-India movement which is based on the vision of volunteerism as a national value, and a mission to mold volunteers, develop communities, has enabled collaborations across India. It is a non-profit organization which has completed 26 projects across 22 states in the span of a year. To introduce Raha, it is an initiative by the Department of Child Development at Manivel Nanavati Women's College to create transgender acceptance amongst the parents. It started as a research project with the development of a website to aid the parents of transgender children and the transgender community. It was also represented at a national level research convention, Anveshan 2020, and has been extensively working in Mumbai by spreading awareness about the transgender community. It has also worked immensely during the pandemic by providing nutritional kits to the PL-HIV transgender folks in the city of Mumbai. Today, we express our deepest gratitude for his presence and participation to Dr. Sanjay Sharma of ATHI, Association for Transgender Health in India. It is a revolutionary organization with the vision of celebrating all hues and colors of gender expression in nurturing environments of an inclusive society. And it aims to achieve this vision through its subsidiary arms of CAME and IPATH. CAME, which stands upon the 4 pillars of knowledge, healthcare, empowerment, and mainstreaming, they bolster its mission to work for the welfare of the transgender people by creating awareness in society and providing a platform for them to use their own skill sets in order to enable them to lead a healthy and dignified life as citizens enjoying equal opportunities and rights bestowed by the Indian Constitution. IPATH, the Indian Professional Association for Transgender Healthcare, envisions people of all gender identities and gender expressions to have unrestricted access to evidence-based healthcare, social services, justice, and equality. Being a national interdisciplinary professional organization, it wishes to promote India-centric evidence-based healthcare, education, research, advocacy, and public policy in the domain of transgender healthcare. Now, as I hand it over to Mr. Zidan Kachi to conclude today's session with a vote of thanks, I would like to share a quote by Andrei Peyhik, the world's first fully androgynous supermodel. I would like to say, respect yourself and be proud of who you are. All human beings deserve equal treatment no matter their gender identity or sexuality. To be perceived as what you say you are is a basic right. Zidan, thank you so much. Thank you so much, sir. Zidan, please do proceed with a vote of thanks. Thank you for the time.
Thank you so much, Gargi. Before we move on to the formal vote of thanks, I would request everybody who is comfortable to put on their video so that we can go ahead and take a picture. So we'll wait for a few seconds so that you put on your videos and we can take a picture before the formal vote of thanks. Also, a reminder to everybody to fill out the feedback forms so that we can do better in these online sessions and try to bring out what is our potential. Can somebody click the picture, please, from the team?
I will be doing it, just waiting for 2 more seconds so that as many people can switch on their videos. That would be great. Okay. Just taking one more. Yeah, that's done. Please continue, Zidan.
Thank you, Kushi. Gratitude is a powerful catalyst for happiness. I, Zidan from VFI, would like to thank our respected speaker, Dr. Sanjay Sharma sir, for giving us a comprehensive overview of gender and a lot of insight on gender-affirming medical procedures while stressing on the importance of mental health factors as well. Here at Volunteer for India and RA, we believe that acceptance is the key to a better life. Through this, we aim to do our part to deconstruct the stereotypes and change the narrative about the LGBTQI plus community in India. Thank you so much, sir, for helping us through your words. We hope you enjoyed being a part of this session. We are incredibly grateful to have had you here today. As we all know that an end signals a new beginning. So today, as we come to the end of this online session titled Gender-Affirming Surgical Interventions, an Overview, hosted by Volunteer for India in collaboration with RAHA Initiative Department of Child Development, Manibin Nanavati Women's College, Mumbai, we hope you can take away enlightening information, the ability to keep an open mind, and the drive to make a change. Thank you everyone for your precious time. We hope you have filled the feedback form, and we would love to have you again during such online sessions. Also, I sincerely thank all the team members from VFI and RA. You all have been excellent sports. Thank you everyone. Have a good evening. I remain.